Good, happy Sunday morning, April 5th, 2020. I'm Riley King, and welcome to the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Sunday morning, so let's begin. 2 more deaths linked to COVID-19 reported in New Hampshire Saturday. Deaths now total 9. 81 new positive test results for COVID-19 in the state. Here's a look at the new cases that came in on Saturday. Let's take a look. And it shows you in each county where the new cases are. So, Hillsborough, 36, as you can see. Rockingham, 26. Merrimack, 4. Stratford, 4. Belknap, 3. Grafton, 3. Cheshire, 1. And Sullivan, 1. Hillsborough has the highest cases. New Hampshire health officials announced Saturday that 2 more people in the state have died of COVID-19, bringing the total to 9. The 2 deaths were male residents of Hillsborough County who were over 60 years old. DHHS did not announce whether either had underlying medical conditions. Officials with the Department of Health and Human Services announced 81 new positive tests, the most announced in a single day so far. The new cases are people living in the following counties: Hillsborough, 36, including 23 in Manchester and 7 in Nashua. Rockingham, 26, Merrimack, 4, Stratford, 4, Belknap, 3, Grafton, 3, Cheshire, 1, and Sullivan, 1. There have now been 621 cases of COVID-19 diagnosed in New Hampshire, with 86 of the cases requiring hospitalizations. 146 people have recovered in the state. The state said 22 of the new cases had no identified risk factors, indicating community-based transmission. Most of the remaining new cases had either traveled domestically or internationally, or had close contact with a person with a confirmed COVID-19 diagnosis. And now let's take a look at your COVID-19 in New Hampshire, what you need to know. Take a look at this. Here's the COVID-19 in New Hampshire information. 621 number of people in New Hampshire who have tested positive for COVID-19. 1,097 and 405 number of people worldwide who have tested positive. 9 number of deaths from COVID-19 in New Hampshire. 86 number of people hospitalized with COVID-19 in New Hampshire. And 8,047 number of deaths from COVID-19 in the United States. This is a map of New Hampshire, and on this map of New Hampshire, it shows you the cases of COVID-19 in towns and cities in New Hampshire. For example, Manchester, 97 cases of COVID-19. If you want to look at this map, we will share this link with you on the Riley King Network Facebook page after the broadcast. New cases each day in New Hampshire. In the purple, daily new positive COVID-19 cases. In the orange, new hospitalizations. And in the red are deaths. And again, common symptoms: fever, cough, and difficult breathing. How it spreads. And prevention tips. And be sure to stay with the Riley King Network on the latest of COVID-19. List New Hampshire religious services live streaming aimed COVID-19 outbreak. Here is a list of online church services in New Hampshire that are doing live streams. Below is a list of religious services and places they will be live streamed online this weekend in the Granite State. If you would like to have your place of worship added to our list, please email community@wmur.com with the name, time, and link to the live stream. And here's the list. If you want to see this list, you can just go to wmur.com and you can find it under local news. And we will share this link with you after the broadcast. New Hampshire epidemiologist. CDC face mask recommendation is another tool to slow the spread of COVID-19. Let's take a listen to that video from WMUR News 9, Tim Callery.
We have less than 100 dairy farms left in New Hampshire. Tell your grocer today to carry milk with New Hampshire's own logo.
You can't get any more local than buying it from the farmer.
Please help save our farms.
State epidemiologist Dr. Benjamin Chan suggests using a homemade mask or cloth-based covering when heading out in public.
When people are in public settings and when social distancing measures are difficult to maintain, such as at grocery stores or going to pick up essential items.
Dr. Chan says recent studies have shown individuals who are infected with COVID-19 may not have any symptoms, but are still able to pass on the virus through close contact.
The purpose of a simple cloth face mask is intended to help prevent the person wearing the mask from transmitting the novel coronavirus to other people.
Especially the most vulnerable.
But I want to stress again that there are people in our communities who, if they get infected with the novel coronavirus, can have more serious complications. They might need to be hospitalized. They could even end up dying from COVID-19.
Dr. Chan emphasizes a face mask is just one tool that can help slow and control the spread of COVID-19.
The primary way for people to protect themselves and others in their community is still through close attention to social distancing, staying home, keeping a safe distance of at least 6 feet between people at all times, and practicing good hand cleaning.
And again, it's important to leave the medical masks and other PPE for local hospitals that need them. In the meantime, the CDC has actually posted a how-to guide on making your own mask like this one at home. We have more information on that over on our website and in our mobile app. Reporting in Manchester, I'm Tim Callery, WMUR News 9.
Okay, and there you go on that video and that report. Aimed pandemic Meals on Wheels in New Hampshire in need of volunteers and PPE. Let's take a listen to that video from WMUR News 9, Mike Cherry.
I'm your Century Roofing foreman. And I'm customer service.
And I'm Dean Solar.
We're the Century Roofing team. Call us today.
Century Roofing, we got you covered.
The pandemic has set a new bar for Meals on Wheels in southern New Hampshire, which has seen an increase of 40 referrals a day from Granite Staters who are food insecure.
We've been adjusting a lot to the coronavirus. We've had about 36,000 extra meals to give to our clients all throughout Hillsborough County.
The goal is to get clients enough meals to last 2 weeks should they need to be quarantined. The nonprofit is also moving away from crowded kitchens that once served hot meals in favor of packing frozen meals to allow easier social distancing. Meals on Wheels says it also needs protective gear like masks, which have been hard to come by.
We've instituted very strict guidelines for them to stand 6 feet away, deliver meals in coolers on their front porch, and also if they have to go into the home, to set it on the table while the individual is standing back at an appropriate distance.
Now, the commitment is roughly 3 hours per shift, and it includes companionship, which can go a long way for a lot of these clients. If you're interested, you can find information on our website. Mike Cherry, WMUR News 9.
Okay, and there you go on that video and that report. New Hampshire Grocers Association urges stores to adapt social distancing and other guidelines. Let's take a listen to that video from WMUR News 9, Tyler Dumont.
Bar Harbor Bank and Trust understands life in northern New England. We think differently about banking relationships, and we take the time to get to know our customers.
While the ring of the registers remains the same, Sully Superette in Goffstown looks a little different.
It's to give people peace of mind that we're sanitized and clean, and we're still here for the community to shop, and we're open.
The food store, one of many in the state that has made recent changes to help stop the spread of COVID-19. Plexiglass has been put up at checkouts, cashiers are wearing gloves, and disinfecting credit card machines in between transactions. And starting next week, aisles will become one way.
I find customers very cooperative in the store and respecting everybody's personal space.
The New Hampshire Grocers Association encouraging all grocery stores to make similar changes. Stores being urged to limit store occupancy and step up cleaning of carts and baskets. Putting marks down on the floor to keep customers 6 feet apart and close every other checkout line if possible. Barriers between employees and customers, and shutting salad and olive bars too.
They're all voluntary, but they're all important. We also want to make sure that all of our customers who are loyal to the stores, that they're going to be safe coming in the stores, they're going to feel safe to be in the stores.
Though customers may face long lines to get in and grab weekly essentials, some say the efforts make a difference.
When you go and you can get the things you need, there's a little bit of peace of mind, and it eases your worries.
The Grocers Association also reminding customers who choose to wear masks or gloves to throw them away properly.
They're putting their groceries into their vehicles, and then they're throwing these on the ground. And that creates an unsightly situation, but also a hazardous situation.
Now, customers are also being reminded not to overbuy or hoard, otherwise limits on supplies may continue. We're live in Bedford tonight. Tyler Dumont, WMUR News 9.
Okay, and there you go on that video and that report. Kayakers rescued from rapids. 2 kayakers rescued in Manchester. Let's take a listen to that video from WMUR News 9.
In this life, there are only so many things you can count on.
2 kayakers had to be rescued after they were seen struggling in rapids in Manchester. Fire rescue teams, as well as fish and game officers, were able to locate the two victims safely. Officials say the kayakers were not using proper equipment for the current conditions.
These two particular victims were kayaking without proper equipment. They didn't have wetsuits, they didn't have helmets, they didn't have any of the proper equipment that they needed for this time of year, with the water being about 40 degrees.
The victims were transported to the hospital for evaluation.
Okay, and there you go on that video and that report. New York coronavirus cases soar as cities across the country brace for coming wave. Let's take a listen to that video from ABC News.
Of course, starting with the latest developments on the coronavirus pandemic. So let's get right to it.
Yeah, that's right. Here's what we know right now, Whit. The CDC has changed its recommendations and is now advising Americans to wear non-medical face coverings when outside. 9 states have issued formal stay-at-home orders, despite the nation's top infectious disease expert, Dr. Anthony Fauci, saying he's concerned not all states are doing so. And President Trump is using the Defense Production Act to prohibit the export of scarce medical supplies.
This as coronavirus cases here in New York City jumped by more than 6,000 in a single day. We have team coverage this morning from New York to Washington, and we begin with ABC's Stephanie Ramos right here in Times Square. Stephanie, good morning to you.
Dan, good morning. Another 500 people here in New York City have died in the last 48 hours due to coronavirus, while hospitals are at their max. The CDC's advice to everyone across the country now: wear a face covering if you're going out in public. This morning, new guidance on face masks. The CDC and President Trump advising Americans to wear face coverings if they need to leave home in order to stop the spread of the coronavirus. But despite the CDC's recommendation, the president says he won't do it.
Well, I just don't want to wear one myself. It's a recommendation. They recommend it. I'm feeling good.
The number of deaths surging in the U.S. New York experiencing its deadliest day yet in the COVID-19 outbreak. The death toll up by 562, now standing at nearly 3,000, with more than 100,000 people now testing positive for the virus. The state announcing it's deploying the National Guard to redistribute medical equipment, including ventilators from institutions that aren't currently using them.
We could have people dying because there were no ventilators, but there are hospitals in other parts of the state that have ventilators that they're not using.
In New York City, the epicenter of the outbreak in the U.S., emergency alerts calling for licensed healthcare workers to help treat an expected surge in new patients this weekend.
This Sunday, April 5th, is an absolutely essential day as we prepare for a very, very difficult week ahead. And I've called to arms all New Yorkers who can help in this fight.
In nearby New Jersey, cases still soaring. The governor ordering all flags at half-staff to honor those who have died from COVID-19. The surge also being felt in Florida, where confirmed cases have gone up by 20% in one day. And in Louisiana, where the governor says they'll run out of hospital beds by next week. In California, Governor Gavin Newsom announcing a new initiative to house the homeless population in vacant hotel rooms across the state.
So if you've just been identified as positive in a homeless shelter, we need to get you out immediately, get you into an isolation unit, into a hotel unit.
In Sacramento, more than 70 members of a church congregation, including 3 pastors, sickened with the virus, despite holding services remotely. In Detroit, drive-through testing is already underway, but first responders and some workers are now being tested with new rapid testing kits that can deliver results in as little as 15 minutes. But the Motor City announcing the death of a city bus driver, Jason Hargrove, who succumbed to the virus. Hargrove posted a message on Facebook last month voicing his frustration at people who didn't follow stay-at-home orders and used public transportation while they were exhibiting symptoms.
And we out here as public workers doing our job, trying to make an honest living. It's folks dying from this. At some point in time, we got to draw the line and say enough is enough.
But there are glimmers of hope. Back in New York City, the rival New England Patriots, a welcome sight for once. The team delivering 300,000 N95 masks to the Javits Center Field Hospital, all thanks to Pat's owner, Robert Kraft. And in Virginia, one family sharing their blessings with others. Buying groceries at the store for at least 30 people in line.
We were just really glad to do it. When everybody was cheering and clapping, I can't tell you just how exciting it was to watch people really get some help and be happy.
And standing here in Times Square where the streets are pretty much deserted, that's odd. Knowing that hundreds of people are at home waiting for this storm to blow over, it is all eerie, it is hard, but one thing we can do is remember the faces of the pandemic, loved ones, first responders, and the doctors on the front lines. Whit?
No question about it. So many people hurting right now. Stephanie Ramos for us in Times Square. Thank you.
Okay, and there you go on that video and that report. And that does it for this morning edition of the Riley King Newscast right here on the Riley King Network. I hope you all have a great rest of your morning. Thank you for watching. I'll see you back here later on today for another newscast. And I'll have a news report coming up in a little bit. Goodbye, everyone.